A hip dislocation that changed the way I practice. The patient was in his 80s. He had advanced Parkinson's disease and fell, breaking his hip. He underwent a partial hip replacement called a hemiarthroplasty. A few days after surgery, he came to inpatient rehab. Upon arrival, his wife was with him and reported that he has been experiencing lots of pain in the hip. His leg is shorter and positioned in a different way than it was prior to surgery, and he's been very confused. None of this is surprising. With advanced Parkinson's disease, the patient had dementia, and the hospital environment, especially with undergoing surgery, getting pain medication, other complications like a urinary tract infection, which the patient had, it can cause a flare-up of confusion, really bad hallucinations, and a flare-up of all Parkinson's related symptoms like rigidity, poor balance, difficulty with speech, and hip pain. When you break your hip and have surgery, it's gonna hurt. No way around it. That's normal. And a leg length discrepancy and different position of the hip is known to happen as a complication after a hip replacement sometimes. The patient was seen by his orthopedic surgeon every day after surgery. So a few days passed and I ordered an x-ray of the hip, and unfortunately it was dislocated. I had to send the patient to the emergency room where an attempt was made to put his hip back into place, which did not work. So he had to undergo surgery to relocate the hip. Ultimately, the patient made it back to rehab, but had a slow recovery. What did I learn from this? How did this change my practice? Anyone with a hip replacement, when there's any doubt, especially a leg length discrepancy, even if the orthopedic surgeon supposedly saw him every day, I'm getting an x-ray. If they even sneeze or look at me wrong, I'm getting an x-ray.